Hello, my name is Dr. Meredith Uhas, and I'm the Director of Mental Health and Wellness for CT State. I'm also the chair of the CT State Care Team, formerly known as the CT State BIT Behavioral Intervention Team. The campus BITs will be renamed to Care Teams to better reflect the broader continuum of needs of our students and the caring and supportive nature of the responses of the team. The Care Team plays an important part in supporting the students' academic success and social well-being within the campus community. This video will help you understand how to respond to a student in distress. As a community member, it is your role to recognize, respond, and refer students to resources and the Care Team. In your day-to-day interactions, you want to be able to recognize student concerns and warning signs listed on this resource. When you identify these concerns, the first step is to have a private, validating conversation with the students. In this conversation, you can express your concerns, ask clarifying questions, and provide empathy. Also, be prepared that during this conversation, you may need to ask if the student is having thoughts of hurting themselves or suicide. Research shows that asking directly about suicide decreases stigma and increases the likelihood that someone will seek help. Most people who have these thoughts are relieved when asked if they have been thinking about suicide. Given the information then provided, determine if this is an emergency, crises, or referral situation. An emergency requires an immediate response, typically a call to campus safety or police or 911. An emergency is when a student has clearly verbalized that they are at imminent risk of hurting themselves or others, having a medical emergency, possession of a weapon, or displayed an act of violence. Afterwards, complete a care referral to document your interaction. A crisis is when a student cannot calm themselves down, but is currently safe and denying thoughts of suicide. Crisis situations are usually variable where a student can fluctuate between calming and escalating. When a student can calm down, you can refer them to campus resources listed on this handout. Or if they continue to escalate, they will need to be assessed by a campus professional. The most common behavior is a lower level of distress, where you offer information and help them contact an on or off-campus resource. A care referral may not be required. A care referral is a way for campus community members to share any observations and concerns about a student. The Care Team is a centralized resource that connects different pieces of information to have a larger context for what is happening in the students' lives. Some items to keep in mind. Your conversations, while private, are not confidential. Sharing concerns not only supports the student, but it also creates a safe community and may prevent a tragic situation from occurring. A care referral is not a response to an emergency. It is to be completed afterwards to document the emergency response because care referral forms are not reviewed 24 hours a day. Also note that care referrals are separate and different than an academic alert. For more information, visit the Care Teams on the CT State webpage. Thank you for supporting a community of care on your campus.